Hi, my name is DiGennaro, and I am here with Moffitt Cancer Center at ASH, looking at our project that investigated treating high-risk MDS with HMA and Venetoclax with a specific focus on anti-fungal use for prophylaxis, is also looking into molecular subset outcomes. And so if you kind of look at this table right here, this was the where we looked into the time to ANC recovery based on antifungal use for both frontline HMA, which means patients that have never been treated with HMA before, as well as relapse refractory HMA and Ven, and that is patients that were treated with HMA monotherapy. And so in this table, you can see that in both cycle 1 and cycle 2, there was no significant difference regarding ANC recovery based on if patients were treated with antifungal prophylaxis versus no antifungal prophylaxis. Then switching gears, up here we are looking at the molecular subset outcomes, and so looking specifically at the overall survival based on mutations, you can see that in these kind of maroon lines, those are patients that had TP53 mutations versus the patients with blue lines, which were pretty much any other combination of mutations that did not include TP53. And you can see that while there was trend towards significant improved survival with patients without TP53 mutations in frontline HMA, there was a statistically significant difference if you looked at TP53 versus all other iterations with the relapsed refractory HMA and Ven. And then over here, the looking at overall survival stratified by stem cell transplant, you could see that both patients with frontline and relapse refractory HMA Ven did have increased or statistically significant overall survival if they did receive transplant. And then lastly, looking at the bottom right, this is looking at the median overall survival based on Venetoclax duration. And you can see that with the 14-day duration of Venetoclax did trend towards improved overall survival versus the patients that had the 21-day Venetoclax. And so kind of the big take-home points for our project is only one invasive culture infection was proven out of all of our patients, so those were rare and independent of antifungal prophylaxis. TP53 does have a poor overall survival compared to all of our other mutation iterations, and long-term outcomes were improved with patients who received stem cell transplants. Thank you.